Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Everybody can see this?
Yes.
Okay. So today I'm going to talk about women's health and particularly gynecological cancers. But I'm going to focus on some of the differences between how these present and are diagnosed in women, in Black women. And I'm going to start out with a story about some cases where Black women were misdiagnosed. So this is starting with a young lady named Jessica Petway. And she was a beauty influencer. She was on Instagram and all those things, and it had a lot of attention for her impact in that way. But she ended up dying at the young age of 36 from cervical cancer. Let's see if I can go away. So in June of 2022, she was hospitalized multiple times due to heavy vaginal bleeding, and she required blood transfusions. She was told at the time that she was having these symptoms because she had fibroids, which is a common GYN diagnosis, especially in women of color. This was new to her, this heavy bleeding was new to her, but they found fibroids, and the people that she saw decided that that's why she was having this heavy bleeding. By February of 2023, she was diagnosed with advanced cervical cancer after finally seeing an oncologist. And a year later, in March of 2024, she had died from cervical cancer. And as we'll talk about during this time, we will learn that cervical cancer is one of the most treatable and preventable of GYN cancers. So it's extremely unfortunate that she died at such a young age from a cancer that doesn't have to kill people. The next story is about Adrienne Moore. She was a 45-year-old respiratory nurse in Atlanta. In 2012, she started having pain and bleeding with intercourse and irregular periods. She was told that it was because of perimenopause, or she was in the years approaching menopause, or that she had ovarian cysts, or that it was fibroids. She had no improvement over the next 3 years. She saw multiple doctors and still was not diagnosed. After missing work due to worsening pain, she ended up losing her job and her health insurance. And then she went another year without getting any care because she didn't have a job or health insurance. When she got another job, she finally was able to see a doctor who did diagnose her with advanced endometrial cancer. So it had been 4 years before she got a definitive diagnosis. Fortunately, Ms. Moore was able to undergo treatment, and she is now in remission. So I'm going to talk about some of the racial disparities in gynecological cancers. Black women often are unfortunate enough to have misdiagnosis and delayed diagnosis of these cancers. Black women experience higher rates of death from many GYN cancers than white women. And women and racial and ethnic minorities are 20 to 30% more likely than white men to experience a misdiagnosis. So these are some of the common sites of GYN cancers. There's cervical, which we talked about in the first with the first case, ovarian, endometrial, vulvar cancer, and vaginal cancer. Cervical cancer, as I mentioned, is one of the most preventable and treatable types of GYN cancer, or of cancer overall. Screening and vaccination are key to prevent the disease. Everyone has heard of the Pap smear, and that is a test that helps with screening, and it can find abnormal cells very, very early in the process so that cancer never has to happen. And we also have a vaccination that can prevent those cells from ever changing into cancer. Unfortunately, still in 2020, there were more than 600,000 women who were diagnosed with cervical cancer worldwide, and almost 350,000 died from the disease. So cervical cancer is caused by HPV, human papillomavirus. This is a sexually transmitted virus that causes the majority of cervical cancers. Most women, by the time they reach the age of 50, will have been exposed at some point to this virus. In the United States, more than 4,000 women do die from cervical cancer each year. It's most often first diagnosed between the ages of 35 and 44. It is the fourth most common cancer in women worldwide and the fourth highest in cancer-related deaths, in spite of how preventable and treatable it is. Black women are 80% more likely to die from cervical cancer than white women. For white women, the 5-year survival rate is 67%, but for Black women, it is only 56%. Non-Hispanic Black women make up a disproportionate number of new cervical cancer cases and are more likely to be diagnosed at later stages. So normally if a woman gets pap smears at the recommended intervals and continues to see her gynecologist, cervical cancer doesn't really have to happen at all. And if we started before that with the vaccinations, it makes it even less likely to happen. But so in order for so many women to be dying, people are missing out on these resources. There was a study that allowed researchers to document factors that were contributing to the disproportionate cervical cancer deaths in Georgia. And they were looking at some of the reasons that are behind the increased rate of death among Black women in Georgia. In Georgia, Black women are almost 1.5 times as likely to die of cervical cancer as white women. And these disparities increase at alarming rates as women age. Black women in Georgia are more likely to have never been screened for cervical cancer, meaning they've never had a pap smear in their entire lives. They are more likely to be diagnosed at a very late stage, and they have a lower survival rate at 5 years after diagnosis. In the study, Black women described callous treatment from their medical providers, an inadequate level of care, and concerns about confidentiality. These issues undermine the trust that they have in doctors and alienated them from gynecological care, thus contributing to poor reproductive health outcomes. So because of all these things, women didn't receive maybe didn't even know about and definitely didn't receive vaccinations, or didn't know about pap smears or the recommendations for how to get them, or just didn't get them. So when cervical cancer is diagnosed at an early stage, the 5-year survival rate is 90.9% for white women, and still at an early stage, it's lower at 85% for Black women. When it's diagnosed after it has spread beyond the cervix, the survival rate drops to 17% for white women and 15% for Black women. So you can see here how extremely important prevention and early detection is for this type of cancer. And as I said before, we do have resources for these. So there are multiple issues that are preventing women from accessing these resources. Some of the symptoms of cervical cancer include unusual vaginal bleeding, a change in a woman's vaginal discharge, pain during intercourse, lower back or pelvic pain, persistent urinary tract infections, constipation, leg swelling, and bone pain. But again, these are cervical cancer symptoms. These are symptoms that may occur once a woman already has cancer. But these are signs to look out for. If any of these things happen, it's important that a woman go see her doctor. Again, prevention, starting at age 9, the HPV vaccine called Gardasil is available for boys and girls. Starting at age 21, it's recommended that every woman start getting pap smears and HPV testing. From age 30 to 65, women can get pap smear testing alone, or HPV testing alone, or HPV and pap testing together. So the difference is that the pap smear actually gets a sample of cells that a specialist looks at under the microscope. HPV testing tests for the presence of the virus that causes cervical cancer. After the age of 65, women don't need cervical cancer screening if they previously have been negative and they've had 3 normal pap smears or 2 HPV tests in the preceding years. If they have a history of abnormal pap smears or surgery due to abnormal pap smears, anything like that, then the recommendations change. So ovarian cancer is the #1 cause of deaths from gynecological cancer in the United States. About 20,000 women are diagnosed each year, and 13,000 women die from ovarian cancer each year. It is very different from cervical cancer in that we don't have the resources in order to prevent it and treat it. It's most commonly seen in women most commonly diagnosed in women over the age of 55. Also in women with a history of breast cancer, ovarian cancer, colon cancer, or endometrial cancer. It's more common in women with a personal history of themselves having breast cancer. And it's more common with certain genetic mutations and syndromes, mainly the BRCA1 and BRCA2 gene, and Lynch syndrome, which is a genetic syndrome that involves a certain subset of cancers. It's women who have never had children are at higher risk. Women who have a history of infertility and who have a history of endometriosis are at higher risk of getting ovarian cancer. But ovarian cancer is most often asymptomatic. And if there are symptoms, they are very vague and can also be associated with a variety of health issues. So if you have any of these symptoms, it's important to see your OBGYN and get a pelvic exam. And the symptoms, like I said, are vague, like bloating, pelvic or abdominal pain, trouble eating or getting full really quickly when you do eat, going to the bathroom very frequently, having an upset stomach, heartburn or constipation, back pain, feeling tired, any kind of changes with your menstruation, and pain during sex. So as you can see, these are things that people may experience at one time in their life or another. And they may be considered, as part of some sort of stomach upset situation, like a GI problem, or just, another one of those things that happens. But it's important to know that any of these things are signs and symptoms that should make someone go see their doctor, especially if they have any of the risk factors that we mentioned before. Endometrial cancer, this picture shows the uterus and the endometrial lining. So the endometrium is the lining inside the uterus. It's the place where, inside the uterus is where the bleeding comes from. That lining is where bleeding comes from when a woman has her period. And we're talking about cancer in that area. It is also referred to as uterine cancer. It is the most common type of reproductive cancer, and the second after ovarian cancer, second deadliest gynecological cancer in the United States. Most cases are diagnosed in women who are past menopause and in their mid-60s. The age-adjusted mortality is 84% higher in Black women than in white women. Risk factors. Risk increases with age, so being beyond menopause increases your risk. Conditions such as obesity, diabetes, and some of the genetic cancer syndromes that we discussed. A history of polycystic ovarian syndrome, meaning when a woman is menstruating, she may have symptoms like irregular periods or infertility, and pelvic pain. Also, a history of breast cancer that has been treated with the drug tamoxifen increases the risk. Starting a woman's period at a young age or going through menopause at a late age can increase the risk. So basically, that means having periods more, starting earlier and ending later, and also never having been pregnant. So if you've never been pregnant, you've also had more periods in your lifetime than someone who has been pregnant. Signs and symptoms. The most common symptom is vaginal bleeding after menopause. It's important to note that any amount of bleeding after menopause, also known as postmenopausal bleeding, is abnormal. Okay, so even if it's just a spot and it's just one time, it's a reason to go see your doctor. So any irregular bleeding when a woman is having a period, so heavier bleeding, even lighter bleeding, bleeding in between periods, that is a sign or symptom that can be consistent with endometrial cancer. Symptoms of advanced endometrial cancer include abdominal or pelvic pain, painful intercourse, bloating, feeling full quickly when eating, changes in bowel or bladder habits, and unexplained weight loss. And you can see some of these are overlapping with the other cancers that we've already discussed. Racial disparities in endometrial cancer. Black women are nearly twice as likely to die from endometrial cancer as white women, even though the disease is slightly more common among white women. There are aggressive forms of endometrial cancer that appear to be more common in Black women. Black women with a history of uterine fibroids have a 40% higher risk of endometrial cancer. And this is according to a study done at Boston University. Compared with white women, Black women have 2 to 3 times the incidence of uterine fibroids, an earlier age at first diagnosis, and greater disease severity. So unfortunately, Black women are also less likely to be evaluated based on established guidelines when they do present to the doctor with symptoms that may be consistent with endometrial cancer. Black and Hispanic women are less likely to receive surgery, hysterectomy, or definitive surgical treatment. Minimally invasive surgery is performed less frequently in Black and Hispanic women. Black and Hispanic women are also less likely to have lymph node sampling or dissection at the time of surgery, and this is important because it can detect if the cancer has spread. Black women are also less likely to receive chemotherapy after they've had surgery for treatment of endometrial cancer. The recommended workup includes just, we start out with a history and physical exam. Next, transvaginal ultrasound is commonly done, and this is done to look for abnormalities in the uterine lining. The ultrasound can look at whether there's a mass that's inside the uterine lining, or if it's abnormally thick, especially in women who are postmenopausal. So unfortunately, this test is often done as an initial test, and but it can be done as an initial test, but it should not be the only test. It cannot determine that you do not have endometrial cancer. It can, if a woman has a very thin lining in her postmenopausal years, it is less likely that she has endometrial cancer, but it's not definitive. So it's one place to start, but it shouldn't be the only test, especially because Black women have a much higher incidence of uterine fibroids, and the presence of fibroids can make it more difficult to miss cases of endometrial cancer when using an ultrasound. Ultrasound scans that measure the thickness of the uterine wall are less accurate when patients have the more lethal non-endometrioid type of uterine cancer, the cancer which is more common among Black women. So it may not be an appropriate test for Black women really at all to initially evaluate them with symptoms of endometrial cancer. The definitive test would be an endometrial biopsy, which is in this picture, we can see like a small, sort of like a very thin straw that goes inside the uterus and removes a sample of tissue that we can send to the lab, and the experts can look at the cells and determine if there's any cancer present. Hysteroscopy means using a small camera that essentially goes in the uterus the same way, and we can look around and actually look at the lining of the uterus. And that this is usually done in along with a DNC, which means dilatation and curettage, or again, going through the opening in the cervix, getting into the uterus, and actually getting a sample of tissue. So scraping to get a sample of tissue. So the definitive diagnosis would involve getting actual tissue from the lining of the uterus to determine if cancer is present. So we've talked about a lot of the disparities and the delayed diagnosis and misdiagnosis. So I want to talk to you more about how you can advocate for yourself, and you can make sure that you get the best treatment, and you make sure that your concerns are heard. So one of the important things for us to do is to make sure we know our own family history. And a lot of times, we don't like to talk to each other about our family history, but it's very important that we know what's going on. It's important to ask our family members about their history of any gynecologic disorders or other medical problems, any history of surgeries or special tests that they've had done. This information can help you and your doctor better understand the risk factors that you might have for certain cancers. If your tests are negative, but you still have symptoms that you're worried about, keep asking questions. I say there may be another type of doctor you should see for further evaluation, but if you're not satisfied, don't let that be the end of it. And, ask your doctor if there's something that they recommend that you do to further evaluate what's going on with you. Also, it's always important to tell your doctor about any symptoms that you notice, even if you don't think they're related. Keep notes about your concerns and bring those with you to your appointments. As we went through the list of some of the symptoms, they're kind of all over the place. It can be increased frequency of urination or an upset stomach. So you may not think that like an upset stomach has anything to do with a GYN cancer, but it may. And there may be some connections that you may not recognize, but the doctor may be able to recognize it when he or she sees the entire picture. Also, it's important, I think, to keep a diary of symptoms and details such as time of day and any relationship to meals or certain activities, and to be very specific. Your doctor, when doing your history and physical, will ask you lots of questions. And that is only to make sure that you do get the best care. It's important to know, all the W's, and also what makes your pain better, what makes it worse. What have you tried to make it better? What worked, what didn't? And even things like time of day can be important. So it's important to take notes before your visit and also take notes during your visit, so that you may not think of questions at the time of your visit, but you might think of something later when you go home after you review the notes. So it's important to keep notes, and so you can make sure you understand everything that goes on during your doctor's visit. And another way to help with that is to bring someone with you to your medical appointments. This person can serve as an advocate and may be a spouse, an adult child, another family member, a close friend, or even a community volunteer. It's, definitely 2 sets of ears can be better than one. There may be something that you miss, but that your friend or family member remembers. So, and especially if you're really nervous or anxious about what's going on, you definitely might miss things. So, and also your spouse or the person you bring, they may remember things that have happened that you may not remember, or you may not think are important. So that can be a good way to help make sure that the doctor gets the complete picture of what's going on. It's also important for you to ask questions, and ask questions such as, what else could this be? If the doctor says, oh, I don't think it's this, then ask, well, what is it? Because something doesn't, or what could it be? Because you still don't feel well, something's still happening. So you want to know what are the other possibilities, and also ask what's next. Are there any other appointments? Do I need to come back and see you? Are there any tests that I need to have done? Do I need to go someplace else and get lab work, go someplace else and get an ultrasound or something like that? And also you want to know what you can do yourself, like how can you monitor your symptoms? What should you look out for? What should you be concerned about if this happens or that happens? So some of the sources that I have listed here are useful sources of information. Most times it's important, if you do go online, you look at sources that are from the government, so that have .gov or .org. The .org means it's a nonprofit organization that does not exist just to make money. And .gov, of course, means it's the government. So the CDC.gov has a lot of information about all types of cancers, but especially gynecological cancers that we're talking about. The American Cancer Society's website also. Memorial Sloan Kettering Endometrial Cancer Equity Program is a special resource for endometrial cancer. And they're looking at health equity, so that Black women, they're looking at making sure that Black women get the care that they are supposed to get. And this other one, Endometrial Cancer Action Network for African Americans, is also looking at health equity for Black women and endometrial cancer. So those are very good resources that you can look to for more information. And that's the end of the slideshow. Are there any questions?